Hello and welcome to this pre-recorded webinar for the Kansas Advocates for Equity, Education, and Health. I'm Shawn Brown with the Kansas Health Foundation and Program Officer for this initiative, and joining me today is my colleague, Blair Weaver, Grants Officer. So in strategizing about this initiative, we used a team approach. So here you'll see the rest of the team members, and they'll be joining us for the live webinar on February 9th. So in conceptualizing this idea, we invited United Methodist Health Ministry Fund to be a part of this effort, with the focus of their funding being on the technical assistance that will be provided during the grant. I also want to recognize and thank members of our Education Advisory Group and other stakeholders who provided input in the development of the RFP and worked with us on this approach. So technical assistance for this grant will be provided by two organizations, Community Catalyst and Sati Impact Consulting, and you'll have an opportunity to hear from them on the 9th as well, and they also played a role in the development process. So the purpose of today's webinar is to provide a high-level overview about this grant opportunity. We'll describe the RFP, we'll cover the program design, and then we'll walk you through the online application, and Blair will handle that. And then on February 9th at 2 p.m., we'll have a live webinar where we'll go into more detail about the RFP, and this will be a chance for you to ask questions. So please bring any questions about policy ideas and strategies you may be thinking about implementing, or anything else in the RFP that you'd like to discuss. So by way of background, I'd like to talk a little bit about KHF's theory of change that supports our vision that every Kansan can make healthy choices where they live, work, and play. We have 4 impact areas: access to care, healthy behaviors, civic and community engagement, and educational attainment, which is the newest addition. So to impact these 4 areas, we seek to help grantee partners increase capacity to implement policy and system and environmental interventions, increase awareness and support among the public, influencers and policymakers, and then increase action at the organizational, local, state, and tribal levels, leading to PSE change. And while this work fits squarely within our educational attainment impact area, we recognize, that there are underlying factors that impact education, such as children being socially, emotionally, and physically healthy and ready for school. So access to care can play a role in encouraging healthy behaviors. So why focus on education, equity, and health? We believe all Kansans should live in communities of opportunity where there are good schools and there are healthy environments and quality jobs and access to high quality goods and services, and that's the norm. But we know that's not the case in every city and town. We believe education is a critical piece of creating and supporting healthy communities of opportunity, and that really multiple systems have to work together to ensure children are healthy and ready to learn. So one of the indicators to track that is more Kansas students graduating from high school, and not just graduating, but being college and career ready when they do graduate. So to improve those graduation rates, we know that the early years are the most critical in terms of making sure children are healthy and they're ready to go and start school and be successful. And so ultimately, the idea is that they're also economically mobile and able to support themselves and their families. So we recognize we can't just silo education, understanding that there are underlying factors impacting educational outcomes, such as intergenerational poverty and health and inequities in policies and systems. So a multi-pronged agenda is really what's needed. So you're likely quite familiar with this graphic or one similar to it, and we know that 20% of health can be attributed to healthcare, with the other 20% being attributable to genetics. But as we see noted in orange, 60% of what determines health is the social, environmental, and behavioral factors. And the most commonly used indicators for social economic status are income, wealth, and education. So that's why we believe that education is central when thinking about health outcomes, because it impacts income and wealth. So the question we asked ourselves is, How can we improve educational outcomes for Kansas children, especially children of color and those in low-income households? And we know the solutions have to be equitable. So what does the research tell us? Kansas with higher levels of education have better health outcomes. Kansans with less than a high school education are 10 times more likely to have no health care insurance. We know that things like gender, race, health insurance coverage, a parent's education level, and family income, those all have a significant impact on how upwardly mobile or downwardly mobile a child's health is. And we know that multi-generational disadvantage requires multi-generational solutions. So we can't just think about children's education and well-being today in isolation. We have to look at the child's environment and what are the resources and the assets in the neighborhood, what's happening in the family unit and the household. And we know we need to focus on the formative years, which is why the prenatal to age 8 timeframe is so important. We also know that our economy is increasingly based on skills and knowledge, and 64% of all the jobs in Kansas in 2018 required some sort of post-secondary training beyond high school. So and we know that the numbers of students that are not proficient in reading by the 4th grade level is remaining a challenge at 63%. So as we began pondering this data, we took this approach: awareness, engagement, and policy and action. And we started with an awareness campaign, Can't Wait to Read. And then we also launched in February 2019 that initiative. We funded the Sparking Imaginations Building Literacy Initiative as part of the Dolly Parton Imagination Library, which is providing books to children from 0 to age 8 in 5 targeted school districts. And then we also created parenting resources in English and Spanish. And then moving into policy and action, we funded the Community Supporting Early Literacy Initiative, which supports 8 multi-sector community collaboratives working to increase the number of Kansas 4th graders proficient in reading. And so getting books into the hands of children and launching these initiatives have been important. But continuing with this focus on policy and action, the next strategy was to go beyond the literacy emphasis and to think more broadly about the systems and environments impacting the whole family to better improve educational outcomes. And we know that COVID-19 has presented a unique opportunity to examine the systems in which inequities thrive, particularly as it relates to education, and to reimagine these in ways that address diverse students and families and the needs so that more children are being set up for success in the classroom. We also recognize the need to consider the underlying impacts and the factors such as the socioeconomic status of families and access to care and support services. And so that's why we're launching the Kansas Advocates for Equity, Education, and Health to support 3 champion organizations to create and implement an interconnected advocacy vision, prioritizing educational outcomes for prenatal through age 8 children. Using a 2-generation approach to advance that agenda that recognizes the many issues and systems that impact low-income children and families, and then focusing on policies that will increase children's long-term odds for academic, physical, and mental health, and ultimately economic mobility. So when we talk about a 2-generation approach, we mean a whole family approach that really focuses equally and intentionally on the services and opportunities for the child and the adults in their lives. And this approach articulates and tracks outcomes for both children and adults simultaneously. And this graphic and the next slide come from a SIN at the Aspen Institute. And so for more information, you can go to their website that talks about 5 principles that need to be embedded in 2-generation programs and policies. And so it's really helpful to check that out. Programs and policies, when we think about this, are usually operating along a continuum. You have policies that are child-focused or parent-focused. Then you also have child-parent approaches that focus primarily on the child, but are moving towards a two-generation approach and include some services and opportunities for the parent. You also have then on the other side, the parent and child approach, which focuses first primarily on the parent, but then is moving towards a two-generation approach and includes services and opportunities for children. So with the two-generation approach, it's really building family well-being intentionally, and again, as I said, working on this simultaneously. And this approach recognizes that families come in all different shapes and sizes, and that families define themselves. So when we say two-generation, it doesn't just mean parents, it's about grandparents or other caregivers in a child's life. So also, when we think about a two-generation approach, kind of going back to our earlier research reference, investments in high-quality early education really yield a 13% return on investment based on increased school and career achievement, as well as reduced social costs. At the same time, we know that parents who complete a college degree can potentially double their income. A parent's level of educational attainment is also really a strong predictor of a child's success. So we know when parents have a higher level of educational attainment, it typically means greater access to opportunities, which means more financial resources to provide for their families and to support their child's education. And then we know that two-generation education programs and policies, they also include employment pathways and early childhood development programs like childcare and Head Start and home visiting. And those are all things, and family literacy, all those things are important to keep in mind. So who will benefit from this initiative? Organizations with connections to Black, Indigenous, people of color, also meaning Hispanic and low-income families with prenatal to age 8 children. So who should apply? Again, we're thinking about organizations with authentic connections to racially and culturally diverse low-income families with prenatal to age 8 children. We're thinking about, is your organization ready to think in bold new ways? Are you having conversations about what are the possibilities? We're looking at nonprofits that are thinking about things and advancing them in a different way to create opportunity for BIPOC children and adults using a two-generation approach. And then just, who are the community champions focused on educational equity and community wellness? And then, of course, qualifying as a 501c3 or either a 509A1 or A2 as noted. So through this initiative, we're asking organizations in terms of the overarching activities to think about how they will create a shared agenda and vision with the support of KHF and United Methodist Health Ministry Fund, which is going to be focused on early childhood education, school and health policy systems change to improve educational outcomes for BIPOC and low-income households. And this would be a shared vision among your local network of organizations that you may already have connections with or be in partnership with as a result of this initiative. It would also be a shared vision among the organizations that are funded to think about, what you might achieve at a state and policy level, So thinking about policy impacts at both the local and state level. And then aid Kansas schools and early care and education providers in designing and delivering equitable educational opportunities. COVID has opened a door that has required organizations and early care and education providers and schools to rethink how they operate. And then lastly, building power for nonprofit leaders and communities engaged in advocacy for equity. And this means looking at how leadership is being cultivated, supported, and ways of keeping the voice of grassroots leaders and the community central. So in terms of the approach that would be used for this initiative, it starts with community conversations at the local level. You know, what are you hearing from students, parents, stakeholders, teachers? What are the concerns about educational outcomes for Kansas children? How are you co-creating educational opportunities with parents and caregivers in mind? And then what are the underlying factors impacting education, health, access to care, and household income? So, and then thinking about, you know, what about mental health of children and their adult caregivers? Prior to COVID, we understood that mental health for children was a huge issue. With the impacts of COVID and those challenges, you know, that's even more troubling, with some children falling behind academically. So what conversations are happening in the community? And then thinking about engagement. You know, what conversations are you having with policymakers and decision makers, principals, school superintendents, the legislature? What are their concerns? Next is creating your vision. What is your vision? What activities will you carry out over the next 3 years when you're thinking about sustainability of your efforts and your plan? Community leaders should be driving policy and action. So during the first year, you'll have the opportunity to focus on this process, which is where the technical assistance support comes in. So examples of some potential policy focus areas are listed here. And these focus areas are not intended as prompts to include in your policy agenda, but merely as general examples. So what data do you have as to what is impacting your community most? How are you using that data in conjunction with lived experiences of community members to implement policies that go beyond, you know, providing services, but actually moving low-wage workers into the middle class? How will you use strategies that intervene in the cycle of low educational outcomes and poverty? So thinking of those kind of economic drivers. When we talk about trauma, we talk about social emotional learning, you know, behavior health and wellness policies for both children and parents focused on trauma-informed schools and care. And so when we talk about trauma-informed, it means schools that are informed and sensitive to trauma and providing a safe, stable, and understanding environment for students. When we talk about trauma-informed care, you know, they're guiding principles about choice and collaboration and trustworthiness, and making sure that the physical and emotional safety needs of an individual are being addressed in terms of providing trauma-informed care. And we'll cover these in more detail on February 9th, but for now, I just wanted to provide a high-level overview. Again, thinking about policies related to healthy families, on building and delivering high-quality systems of care to promote wellness of mind and body and emotional and spirit. And then early child care, thinking about policies to reimagine early care and education experiences, engaging children in learning experiences that are going to foster well-being, language literacy, and healthy development. So what does success look like? You know, centering voices of BIPOC and low-income wage earners and advocating for solutions they deem most impactful for their families is going to be important. If you think back to the approach outlined, this is a crucial step. Also creating a shared advocacy agenda addressing drivers of inequality. The purpose is not for a single organization to come with a predefined policy agenda, but during the first year, you'll be able to take some time to define what the policies and approaches are that you think will be most impactful. So when we talk about centering the voices of BIPOC and low-wage earners, it means being careful of the power dynamics that sometimes happen when organizations come together and think about how they can work in new ways to support policy systems change, and that it comes from the people and seeks to provide full access to equitable pathways for educational, health, economic, and social opportunity. Scaling big ideas focused on the whole child that support a two-generation approach. and child-centered learning will be important. And then helping decision makers to really understand and increase their commitment to greater equitable and health outcomes. So in addition to the grant award, KHF and United Methodist Health Ministry Fund will work with grantees to provide technical assistance to build the organization's capacity and to support policy and programmatic efforts. So Community Catalyst and Swati Impact Consulting will be providing technical assistance with skill building in these areas. So there'll be some coaching that will be offered to help you center community voice. And again, you know, we hear that term, and we know it doesn't necessarily always come naturally or easily to go beyond just hearing from the usual suspects, but that community members have a prominent seat at the table as the group is grappling with different ideas and approaches in policy. There could be, you know, policy development and research technical assistance, assistance with, you know, grassroots organizing and coalition management. So as you think about activities in terms of while you're preparing to submit, it's important to continue to have conversations with interested stakeholders, parents, students, caregivers, and agencies. These are preliminary conversations which we would anticipate continuing through the grant process with a heavy emphasis on community engagement throughout. So, you know, we would ask that you ask your partners to join the live webinar on February 9th to discuss ideas and strategies and pose questions to the planning team. And that you would contact Candace Malone if you would like to attend the webinar so she can send you the link. So in terms of groups that you might want to consider reaching out to, a strong cross-section of organizations with a diverse and well-rounded team are going to be needed to vet bold ideas that the community envisions. And you may already have many of these types of organizations in your network, but now is a time to do some analysis and to identify any gaps or who you might want to talk with or include as you plan your proposal. So these might be, you know, advocacy groups, BIPOC organizations, BIPOC-led organizations, business, community entrepreneurs, child care and mental health providers, you know, safety net providers. And when we say safety net providers, we're talking about those providers that organize and deliver a significant level of health care and other needed services to uninsured and Medicaid and other low resource patients. But, you know, thinking of education coalitions. So there may be a number of organizations that you may choose to reach out to. So what new policies are being considered as a result of the events of 2020 as we think about information that's going to be on the application? You know, of course, your mission and your relation to the proposal, how you're going to address root causes of inequitable outcomes for Kansas students. And then, as I mentioned, you know, really thinking about the events of 2020, meaning the COVID-19 pandemic, the recession, election results, racial justice movements. You know, how did these events that occurred in 2020 shape your organization's thinking regarding addressing the root causes of inequitable outcomes for Kansas students and families? And Blair will cover some of this when she goes over the application section. So in terms of proposal screening criteria, some of the things that we will be looking at are the organization's readiness to effectively implement high quality advocacy work, a clear equity issue area that's important to improving educational outcomes. You know, how well have you defined the issues impacting the community that you're supporting in terms of thinking of children and adults, and what data have you provided that supports that direction? Have you demonstrated an authentic and working relationship with BIPOC or other low-income communities being prioritized in this proposal, and reasonable strategies to center their voice in this work? a clear and thoughtful plan on how to engage in the proposed advocacy efforts. And then lastly, a compelling vision for bold policy that will address barriers to educational equity and really promote greater student success. This is a time to be bold in your thinking and your vision, to take risks for those things that you think will really pay off and what would really move the needle on educational outcomes. So the grant awards, we anticipate awarding 3 organizations up to $100,000 annually for a total of $300,000. The grant period will start on May 1, 2021 and conclude on April 30th, 2024. There are a few funding restrictions, and you may be familiar with these as well. Contributions to capital campaigns, operating deficits or retiring debt of direct mental services, direct medical services, partisan political activities, candidate endorsements, and lobbying as defined by the U.S. internal codes as noted here. I'd like to call your attention to a couple of important dates. Again, I've mentioned several times about the webinar coming up on February 9th at 2 p.m. I'd also like to point out the proposals are due March 5th by the conclusion of the business day, and we really recommend putting in your application early. The grant awards will be announced on April 17th. With the, again, as I mentioned, the grant starting on May 1. We also plan a grantee cohort kickoff meeting on May 27th at 1:30 p.m. And then we plan to, and that'll be like an hour-and-a-half meeting. And then we plan to have another hour-and-a-half follow-up meeting sometime in June, potentially on the 15th or the 17th. And then we also we'll plan to have, annual cohort meetings after the kickoff, and those will be yet to be determined. So at this point, I would like to turn it over to Blair, who will walk you through how to apply.
Thank you, Sean. As Sean mentioned, I am the grants officer here at the foundation. And what I will be doing is taking you through the application process for this initiative, this RFP. So first thing to note is that all applications must be submitted through our online portal. We will be providing some, an overview of what the application consists of and questions on the website for the RFP, so at least you'll have a heads up of what to expect when you actually do get ready to submit. The link to the portal is going to be located within the RFP as well as the website. Once you click on that link, it'll take you here to the login page. I do want to note that if you've submitted an application in the past, you may have noticed that this login page looks a little different. We have recently gone through some updates, hoping to make the user experience better and more enhanced and everything. So if you are a current user, you've submitted applications in the past, you should have received an email letting you know about the changes to the website or to the portal. If you are new and have never logged in, we hope that you find these updates useful and helpful as you go through the application process. So once you land on the login page, a couple things to note. So if you have forgotten your password, you're not sure, it's been a while since you've logged in, you can click here and it'll take you to the option to reset your password. If you are not sure about your username, Candace Malone here, we've got some contact information. She's your point of contact to get your username and then get you set up so that you can reset your password. If you are a new user, you will click over here in the bottom right-hand corner. And one thing that we first ask is if you, oops, not sure what happened there. Let's try that again. I'm not sure what's going on, but the new user, it'll take you through the just some basic stuff, your organization's information, your basic contact information. It's a pretty simple form. Once we get once we get those little bugs worked out, we'll make sure that that's available for anybody who's registering as a new user. Once you are ready to log in, you just put in your username and your password. And it'll take you to our homepage. So once you log in, you can either start a brand new application, or you can go to an application that you've already started. So you don't have to complete it in one go. You can start it, log out, think about other stuff you want to add to the application. You can always come back and submit it later. If you are starting a new application, you would click on Open Grant Opportunities here. And we have anything that is available for application. You can click on it here and then start a new application here. If you are wanting to go back and work on an application that you've already started, you would go to applications, and you can either click here, or we've also got it up here as well. Either one, it's going to take you to the same place. And so you'll click on applications, and then you can click on view and edit, and it'll take you to your application. So you'll see here, we kind of have a little, I like to call it a menu. It lets you know the different sections that need to be completed before submitting your application. We will start here at the very top and go into project overview. One thing to point out, that once you start your application, it pre-populates this field, the project title. That's available to edit. So if you want to update it to something different, you have the opportunity to do so. It just kind of starts it for you here. But then you've got the start date and the end date, providing your project description here, and then your geographic region served. So kind of the basic information about your grant proposal will be found in this section. Next, we have the contact section. So this is where you will indicate all the people kind of associated with your grant or your project and the roles that they play for the grant or project. It will automatically show you as the proposal contact. You can go in and you can edit that. So for example, if you're going to also be the person that is submitting the reports, you can put yourself as the report contact, or anyone else for this grant, you can put that there. Or when you're adding someone and say I no longer am going to be on this grant, like you're 1 year into your grant and I took a different position at another organization and I'm no longer here, you always have the option to come in and just remove this person entirely from the grant, and that way they will no longer be contacted by KHF for any future communication. So it's pretty easy to edit these roles here. And then this box here, it tells you if this person is going to need access to the grant portal. So if you're multiple people are going to be working on this application, you can indicate that here. And what it does is it gives them permission to view and edit the grant. So they can log into the portal and they can access the grant and edit it. So that would mean yes means they get access to edit this application. No would mean that you just list their name on the proposal and they will not have editing privileges. If you need to add someone up here to the table, you would come down here and you would search for their name and click on the little log or the little magnifying glass. And then you've got a list of the names that it kind of comes back with. If they are listed here as a person that we already have in our system, you can select them. And then it's going to bring up all those questions that you saw above when I was editing my role up here. It's going to ask you if they need access to the grant. And again, over here, it's just letting you know that if you click yes, they're going to get an email letting them know that they can access this grant. They can log in, open it up and edit as needed. It's going to ask you what their primary role is going to be. And then if they serve any additional roles down here, you can select those down here. If for some reason, when you search for the person and they don't show up, you can always come over here and you can add them as a new contact. So their name, title, email, phone number, and then right here it says, you know, once you click save, it saves them into our database system, and then you can go and search for them again, and then continue with their roles and, you know, if they need access to the grant. So let's just go ahead and add Gina. So let's just say no, she's not going to need access. Her main role, she's going to be a project director, and we won't select any additional roles, and we'll just say add grant role. And then she shows up here. Okay, next section is the narrative questions. And these are the questions that Sean already kind of went over in the PowerPoint, you know, where it's asking you to describe your organization's mission and how it aligns with the proposal, as well as KHF's mission. You know, all of the kind of the meat and potatoes, I would say, of your application. This is where you would probably want to spend the most time. And it's just, you know, these are just narrative questions. So it's text boxes. So it should be pretty easy to fill out. And again, you can always save and come back to it later before submitting. You can always edit, you know, before you submit. And then the next section we have is the budget section. So again, as Sean mentioned, it's a 3-year grant. So we're going to ask for a 3-year budget, and you can apply for up to $300,000. The way that you do that is that you come down here, and again, we're budgeting by grant year, not by calendar year. So when you add a new budget year, you're telling us this is going to be for year 1 of my grant, year 2, year 3, etc. So you'll select whatever year you're wanting to budget for, and then whatever the amount is for that year that you think you're going to need for salary or personnel. Same thing for consultants. And then you're going to enter up here. We kind of give the breakdown of the justification, what we're looking for, the guidelines that we have established for your budget. You would type your explanation in here, explanation. And then the nice thing is you'll see that down here, it gives the total, it adds up for you, it does the math for you. So you won't have to worry about adding numbers up. You can always, it'll be nice that it kind of double checks your work for you. So it'll do the total for you. And then once you're good and you're comfortable with that budget year, you'll hit save. And then it shows up here in the table. And if you ever need to go back in and edit, you can always go in and edit as needed and say we forgot to add our consultants explanation. We'll hit save. And then it saves it for you. And then the same thing here, it's going to give you the total amount requested. So again, it does the math for you. You don't have to worry about that. So you'll be able to tell down here if maybe you were off by, you know, a couple dollars or what have you. It'll do the math for you. Okay. And then at any time, you can always go back to the menu. If you want to go back to another section, you can always do that. But then the last section I want to point out is the file section. And this is where we have all of the different attachments. So the first thing we've got is the acknowledgement of agreement review. What we have is we're going to provide a template of our grant agreement, a boilerplate, so that if you do get awarded, if you are selected for funding, you can look at that agreement template, make sure that, you know, if you are awarded funding, that the terms listed in that grant agreement are stated in a way that you are able to accept funding from the foundation. And then if you are comfortable with what is stated in that agreement, what we're going to ask you to do is download the acknowledgement of agreement form. Just again, it's just saying you read through the agreement, you're good with the terms that are listed in there, and you sign it. And then what we'll have you do is once you sign it, we'll have you upload it down here below. And then the financial documents that we're asking you to submit is a basic 990, a balance sheet, an official audit if you have one, a financial statement of activity, and a statement of cash flow. If you have any questions about what, any of the documents that we're requesting, feel free to reach out to any one of our grants management staff. We've got a grants@khf.org email, or the number that you can call is 316-262-7676. We're happy to answer any questions you have or work with you on whatever it is that you need us to work with you on. Any documents that you want to attach, you can come down here and you'll select new, and then you'll be able to upload your files here. And then as you can see, we've already kind of uploaded one as an example down here, and they will show up down here. Any documents associated with your proposal can be accessed after you've submitted. If you're awarded funding, or even if you're declined for funding, you can access these documents at any time. You can always open up the application, navigate to this section, and you can always download these here. Once you are ready to submit, say you're good to go, you'll just come down here, you'll click submit, and it always, we kind of give you that chance to, if you accidentally hit submit but you weren't ready, we kind of give you that chance to hit cancel. But once you're sure, you'll just hit submit, and then you should get an email that notifies you of your submission, and then you should be good to go. If for any reason you need to get back into the application, like say you forgot to do something or what have you, you will need to, it is possible to go back in and edit it. You would just need to contact someone at the foundation, whether that's Sean or our grants management staff, let us know, and we can make it available that you can edit again. Otherwise, the only way that you'll be able to view your application is in a read-only format. You won't be able to do any kind of editing. One last thing I want to point out is that we will provide a printable version of your proposal. And again, that will be located in the files section of your application. Usually it takes us about 24 hours once you've submitted it to make that available for you. And like I said, it's just a printable version. Your application all in one view, all of your answers, everything, in case you want to have that for your records. Sean, I think if you want to open up the PowerPoint.
All right.
Oh, sorry, Sean, if we can go back one PowerPoint, I just want to point out Gina Hess. She's our grants associate. She's a good contact to have. Her email, as you can see here, it's ghess@khf.org. And she's happy to answer any questions that you might have, about the application itself or the submission process. And then last but not least, proposals are due March 5th at 5 p.m. The portal is set up that if you start an application before that time, it will still allow you to submit after 5 p.m. However, it does get time stamped. So anything that is submitted after 5 p.m. On March 5th, we will be able to see that, and unfortunately it will not be eligible for approval. So just want to make note that make sure you get your applications in by March 5th at 5 p.m. And I think that's all I've got, Sean. So thank you very much for bearing with me, and I'll let you take it from here.
All right. Thanks so much, Blair. And I want to thank you all for your interest in this initiative. You have my contact information here, so please feel free to reach out to me with any programmatic questions that you would have. I'd love to connect. And we hope that you'll come back and join us on the 9th at 2 p.m. So take care and be well.